for me because I always forget. I was just telling them that we actually had about 60 people sign up for this, so we know it is a hot topic. I think a lot of us who are out there providing services to older adults understand that there's a lot of misinformation, and a lot of times I think people do get worried, perhaps unnecessarily, but then also, how do you know when it's time to maybe advise somebody to, go and get that checked out if you have a concern. So our program today is called What's Normal and When Should I Be Worried? And we are going to be talking about the signs and symptoms of Alzheimer's disease and perhaps other dementias. And we are really, really pleased to welcome Jennifer Romano Morris and Shannon Riley, both of them from University of Virginia Health in the clinical psychology area and the memory clinic over there. So hopefully everybody saw the longer descriptions of our presenters. If not, we can get you that flyer again and the description of today's session. I would ask that if you go ahead and mute your microphones, that usually helps with the quality of the presentation. But if you have a question, our presenters will let us know if they'd like you to go ahead and ask, or just put it in the chat for later. We can do that. Somebody is having some internet issues. Lisa could be on her side. Is anybody else having internet issues? Go ahead and put it in the chat if you are having problems. Mine seems to be fine. Hopefully, it could just be yours, Lisa. I'm not sure. So everybody, okay, Ginny's fine as well. Okay, Lisa, I think it might just be you. Sorry. If you know of people that were hoping to attend today and they were not able to make it, they will be able to view this. We are recording, and this will be available at our website at agingtogether.org following the presentation. So without further ado, I'm going to turn it over to our presenters. Shannon, are you going to be starting?
Yeah, we'll kind of, Dr. Romano Morris and I will kind of hop back and forth. We'll keep it interesting, but I appreciate everybody coming today. And thank you so much, Ellen, for that introduction. Jen and I are really excited to talk with you all today about aging and cognition, what's normal and when to seek some additional support and information, as Ellen had said. And so feel free as we're going along, if you do have questions, put them in the chat and we can absolutely address those. We want to make sure that you get the most out of this that you can. So without further ado, let's go ahead and get started here. So here's kind of what we're hoping to address today. We know that everybody kind of has a lot of questions about aging, cognition, what's normal, what's not. And so first we want to talk today about, what is memory and how does it work? How do our brains change as we age? What is normal with brain changes and what would be unexpected even as people get older, and how to get help when we are concerned or when you are concerned, and then just things that we all can do day to day to support brain health and cognitive health. So that's kind of what we're hoping to address today. And to get started, let's go ahead and talk through memory and thinking.
All right. So as Dr. Riley had said, as Ellen had kind of introduced us, Shannon and I are both neuropsychology fellows. And so we work in the Department of Neurology. And our specialty, we're both trained as clinical psychologists, but really our specialty is brain behavior relationships. And so we did a whole lot of, schoolwork and training to really understand cognition. And And, I think that neuropsychologists are unique in that we really do have a great understanding of what is this human behavior we call cognition or thinking. And so memory is, a domain of thinking. And so I figured we'd start off with just kind of getting some grounding about, what is memory? How does it work? And so to kind of start off, I thought we'd do kind of a little experiment here. And this kind of brings, anytime we talk about memory, it brings up the question, well, why do we forget? So I just want you guys to take a second and I want you to think back to a really vivid memory. You can close your eyes if you want. It could be, a graduation or a marriage or birth of a child or the first time you laid eyes on the love of your life, okay? So notice any sights that, come to mind, any visualizations, any sounds, perhaps even smells or any kinds of feelings or emotions, and just take a second and bring that memory kind of to your forefront. All right, now that you've got that fresh in your mind and you're reliving it, now I want you to tell me, what did you have for lunch last Thursday? Probably harder to remember, right? And so, this example kind of illustrates that memory, it doesn't work like a video camera, right? Our brains are really designed to be optimal, right? And so if our brains were recording every little bit of information, it probably would explode. And so, when we are taking in information, our brain doesn't record it like, the Zoom is recording our talk right now. It has to kind of go through a filter or a series of filters before it's going to be able to get encoded and stored later. And so memory is really a complex behavior, and it requires these multiple sub-processes, and all of these little processes are vulnerable to disruption. And so, at the start, we've got to be able to pay attention to something before we're going to be able to, encode it, store it, or retrieve it. And so, in the example that I just gave you, there was probably a lot of motivation for you to remember all the sights and sounds of that really important time in your life. And so, you're likely able to recall this information and this memory so vividly because your brain was trying to soak it all in. It said, this is important, let's get all of this information in. And that's really how our brains evolved, right? We want to remember the important things. And so, back in our, ancestral days, that was, okay, we have to remember that the pink berries are what upset my stomach and I shouldn't eat those. And so even though, that's how our brains evolved, and even though we're not having to remember that the pink berries maybe upset our stomach, our memories are a little bit more complex, the hardware that we use is still the same. And so in that second situation of remembering what you had for lunch, there probably wasn't much motivation to remember that you had your cheese sandwich, right? Unless, of course, there was something really notable that happened with that cheese sandwich, like, a bug crawled out of it. Anything that becomes novel or new is something that our brain kind of attaches to and wants to remember. So how does that work? So we can think about memory in 3 different kinds of phases. So we have what's called encoding, storage, or retrieval. And so encoding is really our brain's ability to get the information in. Storage is our ability to hold on to that information. And retrieval is our ability to pull that information back out when we need it. And so as we talked about a little bit before, this encoding stage is really important because we first have to be able to pay attention. If we're not paying attention to something or we're not attending to it, our brain isn't going to process it any further. And as we all know, attention can wax and wane throughout the day and can vary depending on kind of what's going on. And so once we're paying attention, it goes through this process or type of memory called sensory memory or working memory. And this really has a limited capacity to it. So we can only really hold about 4 to 7 pieces of information at a time. And really that makes sense, right? You can't hold every thought at once. And so, our working memory is designed just to kind of have that information in the forefront. And eventually the memory that's in the working, the information that's in the working memory gets transferred to the long-term memory storage, right? Where this is where we think of kind of the infinite capacity, right? There is no limit on how much information can be held in our long-term memory storage. And then our brain retrieves this information from the long-term storage when it's needed, right? So this is kind of how what we think of from a cognitive standpoint, how memory works. So what exactly does this look like in the brain?
And before we get to that, Dr. Romano Morris, I just wanted to add that it's really important that she talked about attention and being able to pay attention. And even before that, we have to be able to hear or see to be able to pay attention first. And so that's why we always talk about that it's so important. If you're having any troubles with vision or with hearing, that could certainly be affecting your memory down the line, because if you don't hear it, process it, pay attention to it, and code that information, you're pretty well not at all going to be able to recall it out again later. So that first piece of that hearing, processing, paying attention is really, really important. And so let's go ahead and take a look at what this looks like in the brain.
So essentially, I kind of need that highlighted from a cognitive, this is what, our model or our theory of how memory works. But from a biological standpoint, what's actually occurring in our brains is at a neuronal level, or basically our neurons or our brain cells communicate through electrical signals with one another. And so these electrical signals release chemicals called neurotransmitters. And these neurotransmitters are really what kind of help activate or deactivate certain parts of our brain, and are really the building blocks for any kind of thing our brain controls, right? And so the more a neuron communicates with one another, the stronger those connections become, and the more laid down this neural pathway becomes. And again, this goes back to our brains being an efficient organ. So the more that those pathways get laid down, the quicker that information gets transported and allows our brains to work more efficiently. And so this is what, we kind of call procedural memory sometimes. So the more those neural pathways get laid down, the less conscious thought you have to have behind, completing a behavior. So thinking about like riding a bike, they always say, oh, it's just like riding a bike. It comes back to you. You don't have to think about it. And that's because, as you were growing up and learning how to ride a bike, those neural pathways got laid down and kind of tread on. And so those roads are really well paved. And so that memory comes back very, very quickly and efficiently because it's a strong neural network.
Versus, I would say that cheese sandwich that you had, that's not well worn at all. That's just a little blip in what happened several days ago. So those pathways are not well worn down. So it's a lot harder to come up with that.
Right. And that kind of leads to, this next part is, when these communications aren't laid as frequently, it can be really hard. It can be harder to activate those networks and retrieve the memory, even though that memory was once there. So again, going back to the cheese sandwich example, right? Probably if I had asked you that question Thursday, an hour after you had eaten lunch, you may have been able to pull that, oh yeah, I had cheese sandwich today for lunch. So that information was once there, right? But it just might be harder to come back and retrieve that information because that neural network is not as trodden or well paved. And so this is why it might take you a while to recall what's the capital of Germany, right? Something that you learned. And this is stored in what we call semantic memory, or just your memory for facts, right? And so even if you aced your 5th grade geography test, you might take a second and go, oh, gee, what is the capital of Germany? Before you come up with the answer of Berlin. And so, for these weaker neural networks, it could be easier to recognize this information rather than freely recall the information. And so the way I like to talk about this is thinking of your memory kind of like a filing cabinet. So we know that file for Berlin is in there somewhere, It's just taken you a minute to figure out, okay, where are capitals, find that folder and pull out that capital. And so, we call that kind of recognition where, we've got this little guy here who says, hello, my friend. Yes, you look familiar, versus recalling what is his name. That might be a little bit harder to do because that neural network might not be laid down as fluidly.
And it's not just memory that's important in the brain, right? There is, as Dr. Romano Morris mentioned, there are neural networks all over the brain. So all parts of the brain are interconnected with each other and work together to help us do pretty much everything that we have to do. But there are spots in the brain that are particularly kind of the centers of different aspects of our thinking. And, as Dr. Romano Morris said, we are very focused on brain behavior relationships as neuropsychologists. We won't go into it too much today, but I just wanted to give a really, really high level overview that when we think about our memory, we're talking about kind of the temporal lobe to the side here. That's in charge of our memory, but also things like speech and hearing as well. Our frontal lobe, kind of in the front of the brain here, is in charge of our being able to pay attention, process information, and do such higher level things like planning and organizing, planning things for the future, making big decisions, things like that. The back of our brains are more important for processing visual information and integrating visual information, but also such things as being able to balance, sit up straight, even have our heartbeats regulated, and being able to be aroused and alert to pay attention to things. So our brains do a whole lot to keep us moving and shaking day to day. And even more complicated than this, within each lobe of the brain, there are different specific spots that are in charge of different tasks that all work together to allow you to be able to sit up, stay alert, listen to, process, and understand what we're saying in this talk. And so now we have a little bit of a better understanding of how our brains work, how they support our memory and our other thinking abilities. And so let's go ahead and get into the meat of this talk of what is normal aging, and then what is abnormal aging.
So, when I like to kind of think about cognition, I like to think about it, from a developmental perspective. And so this little graph here kind of shows cognition from birth all the way to death, right, across the lifespan. So if we look kind of at that first part of the graph, we see, from development, ages 0 to 24, this is really where our brains and our cognitive development, accelerate at the greatest rate. We're learning, that's your job as a kid, is to learn and take in the world and lay down those neural networks and get rid of the neural networks that aren't as important, so that you can have kind of your optimal functioning. And so, our cognitive abilities pretty much peak in somebody's late 20s, early 30s. And then
unfortunately, we're all downhill from here.
That's right. We're downhill from here. And so after that point, it's normal that our cognition begins to kind of decline as we move through the developmental stages of adult life and older adult life. And so, again, there's some normalcy to having some declines in our brain. And you see this kind of second little dotted line here is really kind of what we get concerned about when we think of abnormal aging. And so we want to kind of prevent that altering level where that slope of cognitive decline goes down really quickly. And so that's kind of what we're going to spend a little bit of time today talking about, ways that we can slow down that trajectory.
Absolutely. Yeah, that's perfect. And that sounds, it's really important to recognize that cognition and thinking is important across the lifespan. It's not just that we're learning skills from 0 to 18 and then things are pretty much the same the rest of our lives until we're 70s or 80s. We're still learning and processing and building our neural networks throughout our lives. And so in this adulthood stage of 25 to 65, we're applying that information that we learned to then be able to kind of consolidate it over time. And as Dr. Romano Morris mentioned, there's a lot of different factors that affect the brain, and we have them, some that are effective, particularly in the developmental stage. So even from prenatally before we're born, all the the way up to age 25, when the prefrontal cortex, the decision-making part of the brain, is fully developed finally. And then we have factors that affect the brain more in the aging spectrum, more as we move on in years in our 60s, 70s, and 80s, but even in our 30s, 40s, 50s as well. And you'll notice here that there's two different kind of columns here, and you'll notice there's a lot of similarities between the two. The things that affect the development of our cognition in our early years, and again, even before we're born, are really similar to the factors that affect our ability to maintain and strengthen our cognitive skills over time. And so those are things like our prenatal environment and prematurity, more physical health when we're born and even before we're born, as well as physical health as we age. Nutrition and vitamin deficiencies, that's really, really important, both for brain development, but also we get nervous about, certain vitamin deficiencies causing problems with our thinking as we get older. Educational enrichment is really, really important for nailing down those neural pathways. And that's something we'll talk about a little bit more going forward, but building that learning, those educational experiences early on is really important to continue as a lifelong pursuit of cognitive enrichment for being able to build those neural pathways. Some other things that affect our brain development, both in early development, but then also as we age, is thinking about different substances. And so alcohol and illicit drug use in utero certainly affects a baby's brain development. And that's the same throughout our lives. So sustained substance use can have negative effects on the brain. And even as people get older, even prescription drugs, prescription medications that weren't problematic throughout the lifespan tend to start having side effects later on in life that can create more confusion or kind of slow down the thinking processes. And so that's just another factor to consider, as well as our emotional well-being, right? How we feel affects how we think. And so focusing in on making sure that your mental health is good is also important throughout the lifespan for supporting your brain health. So let's talk about, factors that affect the brain. Let's talk about how to build up brain health. And I want to talk about this concept called cognitive reserve. It's kind of a fancy phrase, but basically the meaning behind it is just that in intellectual enrichment or cognitive enrichment throughout the lifespan, people who develop that are better able to withstand disease progression even later on. And so it might be that there's an underlying pathology or something that's going wrong in the brain, potentially could be Alzheimer's disease that's developing in the brain, but people who have really strong cognitive reserve, and we'll talk about how to build that, they might have that structural change of the Alzheimer's pathology building up in the brain, but you're not able to see it on the outside. It doesn't affect people's thinking or functioning day to day. They might still be able to do the things that they were always able to do because of this cognitive reserve that they built up. And I like to think about this as, it's building more efficient neural networks in the brain. And it's kind of building a bunch of different pathways so that if one pathway isn't working anymore, they can find other ways around it so that you can still get to the same place, come up with that word that you wanted to remember, even with the underlying disease pathology.
Essentially, a good brain to start off with,
yes,
declines a lot slower than a bad brain.
Yes, exactly. That's a really good point. Yeah. So building that brain strength early on kind of gives you a boost for later on. And so let's talk about how to build that cognitive reserve, how to boost your brain health. So we've already talked about that education, early and lifelong learning is one really strong way that you can build up that cognitive reserve, that brain health. And so that can happen through formal education or through things like hobbies. challenging yourself to learn and do new things, even outside of education or work. But certainly cognitively challenging work throughout the life is another way that you can build up your brain health and build that cognitive reserve. Leisure activities, like I kind of think about this as anything aside from passively watching a movie kind of works for me. So you can certainly watch a movie, relax, but then talk about it with family and friends, really kind of process that, debate about it. That's a cognitive leisure activity, but it can be anything that you're interested in. It can be reading, doing crossword puzzles, whatever it is that you like to do. The big things we talk about are being cognitively active, socially active, and physically active. And so spending time with other people that you love, friends and family, that can actually boost your cognitive reserve, as well as aerobic exercise. And we'll talk about that more a little bit later. But these are just some ways that you can boost your brain health to make it less likely that any changes that happen in the brain can kind of show up on the outside and get in the way.
Yeah, and essentially these things are good for our brains at any age. That's kind of the
really
bottom
true.
line.
Yeah.
Whether you're, a 10-year-old, a 24-year-old, a 50-year-old, or a 60-year-old, or a 90-year-old. These are things that are good for our brain. And so the more you can do those activities as a younger age, the more cognitive reserve you can build up. So in terms of what are the physical changes that happen in our brains as we age? So as I said, the aging process is a normal part of life, right? And so there are physical changes that happen in our brain, just like there are physical changes that happen in any other part of our body. And so one of the biggest changes is that our brains tend to shrink in volume as we get older. And so essentially the volume or the weight of your brain declines at a rate of about 5% per decade after the age of 40. And then this rate tends to accelerate after the age of 60. And so, why does that matter? Well, certainly, our brains are composed of those neurons or those brain cells. And so if we're losing those brain cells, right, or there's atrophy, meaning tissue loss, that means that those brain cells aren't there anymore. And so this is where kind of your brain might have to find another way around it, which is why it might take longer to remember information. And so, that loss, that tissue loss, affects the parts of the brain that control memory, control balance, and control what we call executive functioning or that higher order thinking. So going back to kind of the diagram that Dr. Riley was showing in terms of the different parts of the brain, the ones that really get affected, that we see the most amount of atrophy, are the parts of our brain that affect our memory, balance, and our higher order thinking. And so as a result of these changes, or actually before I get into that, if you take a look, here's an MRI. And so an MRI is a picture of your head. And so if you're thinking, if you're looking at this MRI, just to orient you, at the top is basically it would be as if you're laying down, right? And so they kind of took a slice of your brain, you're laying down. And at the top would be where your eyes would be. At the bottom is kind of the back of your head. And so if you take a look, this is a slice of somebody's brain at 42 years old versus 82 years old. And the important piece here is that both of these people are healthy, normal adults. Right. And so you can see, even though this 82-year-old has less brain volume, this is still within normal limits, and they're healthy and functioning just the way that they're supposed to. But you can see how there's less tissue. There's more black space, right, on this image compared to, I'm moving my mouse here, and I realize that you can't see my, my screen. There's more black kind of on that 82-year-old side versus the 42-year-old side, because there's more tissue. And so this is, again, a normal process of aging.
Like this,
and so as a result of that tissue loss, this also accompanies declining levels of neurotransmitters, which again are those chemicals that provide that communication. We've got changing hormones. Our blood vessels tend to deteriorate as we get older. And so that impairs the circulation of blood glucose, or basically the energy that our brain has to work, which all of these physical changes can result in changes in functioning.
That's right. So let's talk a little bit about what are normal changes in thinking or cognition as we get older that accompanies this shrinkage in the brain volume, as Dr. Romano Morris had talked about. And so kind of typical changes in cognition, not great changes, it frustrates people sometimes, but it's totally normal for people as they get older to have a harder time processing information quickly. And so it just takes a little bit longer to come up with the word that you wanted to remember, the name that you wanted to come up with, to process what other people might be saying. It might be a little bit harder to pay attention and to think flexibly, kind of come at problems from different ways in the same way that you could have done way back when your brain was in peak form at age 27 or 25.
I always like to call this, you get sticky in your thinking.
Yeah, exactly. Yeah, you get kind of stuck and it's hard to come at problems from a different perspective. And it's harder, perhaps related to some of this more trouble processing information, paying attention. It's a little harder to learn information and harder to remember that information later on. Not that you can't do it, but just that it gets harder to do. And so the way I like to think about this is actually thinking about computers. They're always being updated every year, it feels like. But if we take a look at this computer here on the left, this older, more outdated computer, we can kind of think about that as the older brain, that it's still, it still works. It just works more slowly, takes a little bit more time than this younger computer that has more updated processing platforms, Windows 10 or whatever it might be versus the old HP that we used to have. So slower to switch between programs, and it doesn't accept that newer software as well. So it's harder to learn new things sometimes, but it still does everything that the newer computer does, still stores information, recalls it back up, just takes a little bit longer. So that's kind of normal changes in thinking that we might expect, but it's not all, negative changes as we get older. There are some things that really improve as people age. And those cognitive skills that improve as we get older are wisdom. People have a lot of, as they move on through life, a lot of experiences that they're able to draw on and kind of coordinate their ability to use the facts, the knowledge that they know, and the procedures that they've developed and kind of laid those neural pathways down in the brain. And so as people get older, they're a whole lot wiser, that's for sure. If you think about, a 75-year-old versus a 22-year-old, they're able to think through things a whole lot better, I think. They're better at solving social dilemmas, kind of coming at things from other people's perspectives as well as their own, knowing how to do things. And so, you think about a surgeon who's still working at 70, 75, 80, who still has the processes laid down of how to do these complicated surgeries better now than he or she was able to do way back when they were a resident early on. Semantic knowledge or knowledge for facts builds up over time, so gets stronger as people age, as well as verbal abilities. As people age, they have a much more extensive vocabulary than somebody who is younger. So a lot of positive changes in thinking as people get older as well.
And so, when we think about, any kind, like cognition is just another human behavior. And so when we think about any kind of human behavior or other human characteristics, the way that people age falls on what we call a normal curve. And in neuropsychology, we love normal curves. That's pretty much what we use day in, day out to kind of describe what's normal and what's abnormal. And so if you look at the normal curve that I've got here in that lower right-hand corner, this is what a normal curve looks like. And so if you think about, if everybody was an individual data plot that would kind of create this curve, right, where most people are going to fall in the middle. And then some people are going to fall below average, and then some people are going to fall above average, right? And so when we think about, what are the people who age actually really well? We're going to spend some time talking about what happens when you're not aging as well as we'd hope. But what about the people who age really well? We call those people super agers, right? And so specifically the research that looks at super agers, they kind of operationalized or defined them as folks who are performing cognitively and physically at 2 decades below their age. So basically an 80-year-old is performing cognitively and physically, as someone in their middle age, right? In their 50s or 60s. And so, neuroimaging that's been done on these groups have revealed that there's actually differences in their physical brains, in addition to these in addition to the functioning that we see. And so the part that's different is called the cingulate cortex. They have a thicker, or they have more brain tissue in what we call the cingulate cortex, which is the part of our limbic system, which involves kind of both our emotions, our formation of emotions, as well as processing and learning. And so if we think back on some of those things that we talked about, what gets better with age, in terms of having that knowledge and being able to process and having that wisdom, those are that integration of kind of emotions and thinking, that really kind of boils down to that cingulate cortex. And so we've got a couple examples of super agers. So first and foremost, today is Queen Elizabeth's birthday. She is turning 96 years old today and is still, running a country, right? And so she's a great example of a super ager. Another person who's near and dear to my heart, because she's a neuropsychologist, is Dr. Brenda Milner. So she's one of the founders of neuropsychology and did really important work looking at memory and how our brains work. And she is still lecturing at the age of 103. And then we have Stanislaw Kowalski. And so he, at the age of 105, became the oldest ever competing athlete. So, there is a lot of variation in aging, and these are kind of the exceptional in terms of, people that defy, kind of defy what we think of as what happens with normal aging.
And so this is kind of abnormal in the sense of being much better than we would have expected. But let's talk a little bit more now about, I think, what you all are interested to hear about, what's more abnormal, lower than we would be expecting. And so we've talked a lot about normal aging, and let's compare that with what's not normal, what we wouldn't expect. And you can see some examples here. The big picture is that when people age, what's normal is that things take longer. Things are harder than they used to be, potentially. Yours might be slower to think through things. You might hesitate a little bit more before you do something. Look before you leap, which in some cases is a good thing, I would say, but might be more thoughtful before moving forward with things. It might be harder to, like we talked about, retrieve the names of words or names. But that's different from, again, harder, slower to do things. That's different from can't do things. So you really can't think the same that you used to, can't do things like you used to do. Not just that it's slower and harder, but that you literally can't do it anymore, can't get started, figure out what the first step is or how to sequence the steps in the same way that you used to. As Dr. Romano Morris said, you get stuck in your thinking, you can't move on, can't place the person. So not just that you can't recall the name, but you don't recognize where you know that person from.
Can't find the file.
Yeah, can't find the file. That's exactly right. It's not just that it takes longer to get through that Rolodex, it's that it's lost in there. You really can't pull that out anymore. And not just that words take longer to come up with, it's that you can't come up with that word, even if you give yourself the time to do it. And there, more confusion about the past, the present, not just, oh, I'm retired, what is today, but getting confused more generally about time and what things are going on around you. So that's kind of a difference that we want to think about what's normal, harder, slower potentially versus can't. There's a big change that you or somebody else might notice. So let's talk about some risk factors for cognitive changes, cognitive decline, what's abnormal. sometimes people get worried about, with Alzheimer's disease, oh, my grandma had that, or my dad has Alzheimer's disease. Does that mean that I'm going to get it? And genetics plays a part, but it's a really, really small part. Actually, the biggest risk factor for any type of dementia is age, actually. So as people get older, they're more likely, percentage-wise, to develop something like dementia. Even aside from any of these other factors. But there are some things that, we can't control getting older, but we can control some of these other health conditions. And so things like high blood pressure, high cholesterol, diabetes, having a stroke, obesity, these are all conditions that increase stress on our heart. And what affects the heart affects the brain. And so if you have heart or vascular problems, that's a risk factor for having brain problems as well, and having more of that neuronal loss that we talked about. Health behaviors as well. Smoking is a cardiovascular risk factor as well for some of those health conditions that we already talked about. And so things like smoking, physical inactivity, we talked about that physical exercise is really helpful for brain health. So the opposite is going to be negative for brain health, unsurprisingly. Sleep problems, I think those are pretty common, honestly, especially as people get older, but sleep problems are important to address, talk to your doctor about, because fragmented sleep, so having troubles maintaining sleep, as well as not getting quality sleep, so not feeling rested when you wake up. That can suggest potentially an underlying sleep disorder like sleep apnea, where your brain is not getting enough, you're not getting enough oxygen during the night while you're sleeping. And so it's really important to talk with the doctor and treat that, because getting quality sleep of good quantity is important for actually consolidating memories. So your brain is actually doing good work while you're sleeping. And so if you don't get that sleep that you need, your brain isn't as well able to consolidate the memories that you develop from that day, put it in the file cabinet in the right place so that you'll be able to pull it out again pretty efficiently later on. So those are kind of risk factors for people in and of themselves. But I want to bring up one other thing that's close to my heart, talking about caregivers or care partners of people loved ones who have mild cognitive impairment or dementia. Caring for somebody who has cognitive problems has actually also been shown to be a risk factor for developing cognitive problems themselves. And so that's something that's really important for us as a field to look at, and for people who are caring for loved ones with dementia or with cognitive problems, to help take care of themselves and make sure that they are doing okay, so that they can care for their loved one, but also to promote their own brain health.
So I always like to kind of show, this is one of my favorite graphs in terms of talking about what does cognition look like over time. And so, the first, you'll see on one side is cognitive decline, and then kind of on the other axis is time, in years. And so the first two lines, those two green lines, really represent what we think of as normal aging. And so there are some of us who, stay exactly the same, as they were when they were 25, when they're 85. They don't really experience as much change as we would expect, but there is such a thing as normal aging, as we've discussed, where we can expect some declines to happen. And that's really that second green line. Where we start getting worried, or where we get concerned, is where we kind of hit that blue line. And so that blue line represents what we call mild cognitive impairment, or MCI. And so this is basically meaning that somebody's beginning to notice changes in their thinking, or their family member is noticing changes in their thinking. And we see some of that impairment in our testing, but generally they're still able to kind of care for themselves and do the things that they used to be able to do, things like, brushing your teeth, grooming, dressing, managing finances, managing medications, all things we call activities of daily living. And so mild cognitive impairment basically means you're having some changes that aren't consistent with normal aging, but generally you're still able to kind of compensate and care for yourself the way you once were able to do. And so we get concerned about mild cognitive impairment because it does increase your risk of developing a dementia. Most people who have mild cognitive impairment do not go on to develop a dementia, but it certainly increases your risk. And so it's something we get concerned about. And so when we say, what is a dementia? You see kind of the line splits, right, from a light blue to a dark blue. A decline to dementia means that you have cognitive impairment. So you're having changes in your thinking that are not consistent with normal aging, and they are now affecting your abilities to care for yourself the way you once did. So these are a nice visual representation of the different paths that cognition can have as we get older. Everything from normal, super aging to normal aging to mild cognitive impairment or MCI to dementia. And so when we talk about dementia is really an umbrella term, right? That just means you're having changes in your thinking that are not consistent with normal aging, and they're impacting your ability to care for yourself. That's really all that word means. And there are hundreds of different types of dementias out there. Okay. And so most people are familiar with Alzheimer's disease. It is the most common form of dementia. And so, it's a dementia that tends to affect our memory. And so that's kind of where we kind of put those pathways down about memory, why it's important. But there are hundreds of different other types of dementias. So some of the top ones are, dementia with Lewy body, vascular dementia. And then there's some other ones that are related to things like Parkinson's disease, Huntington's disease. And then we, of course, have people who have a mix of these conditions. And essentially, when we are defining these different conditions, they're distinguished by different disease processes in the brain. So different types of abnormal proteins that build up in certain ways in certain parts of the brain are what distinguish these conditions. And so they often manifest in different clinical symptoms. But oftentimes when we're making a clinical diagnosis of a particular type of dementia, we're not 100% sure that that's actually what the pathology is in the brain tissue. So we kind of just take our best guess. But really, again, at the end of the day, dementia is an umbrella term. And so, oftentimes we get the question in clinic, well, I think I have dementia, but not Alzheimer's disease. And really, those are the same thing. Those two words are one and the same. So before we can make a diagnosis of dementia, right, now that we've defined it, it's really a diagnosis by exception. And so we actually have to do a lot of ruling out before we can rule in dementia. And so some of the things that, can affect our cognitive and functional changes that aren't dementia are listed here on the slide. And so I always like to use this little mnemonic here, in terms of thinking about drugs, emotional disorders, metabolic conditions, eye and ear dysfunction, as Dr. Riley had pointed out earlier, nutrition, tumor and trauma. So these are all things that can influence our thinking that are not really consistent with a dementia. And really, oftentimes these things cause what we call delirium, which is essentially an acute or short-lasting change in somebody's mental status that can be reversed. So this goes back to some of the things Dr. Riley was talking about before in terms of medications, alcohol or substances, but also things like urinary tract infections or vitamin deficiencies. These are things that if they are addressed and treated, somebody's cognition returns to normal. And again, as we talked about before, those sensory changes such as declining vision and hearing can also in fact influence somebody's cognitive functioning. And again, it goes back to if we can't perceive it, we can't process it. So it's not going to get recalled later. And then, of course, other injuries to the brain, things like tumors and psychiatric conditions, all have to be ruled out before we can say that the cognitive changes are associated with abnormal aging.
So Dr. Romano-Morris just talked about reversible causes of thinking changes, that it's not a dementia, but it's something that we can fix, we can modify. And so I like to talk about that in terms of these other memory thieves, other types of modifiable factors or things that we can change that might negatively affect our thinking, our memory. And these are things that I think a lot of us are experiencing right now in the context of the pandemic that is going on for now over 2 years. chronic stress. There's always things in the back of our mind, potentially, not just about COVID, but about, any number of things that are going on day to day. Potentially feeling more depressed, feeling more down, and being more socially isolated, whether or not that's related to kind of the social distancing and physical distancing that's been important during this pandemic. Things like chronic stress, depression, and social isolation, they can all get in the way of not just our mental health, but also our memory and thinking. But again, these are risk factors for developing dementia, developing cognitive decline, but they're things that we can treat and work on to help not just mood, but also our thinking skills. So we've talked a lot already through this presentation about, what's normal, what's abnormal in terms of people that are super agers or people who might be having, or things that make us cause for concern about having more troubles than we would expect just for normal aging. And so if you or somebody is concerned about thinking changes, we wanted to talk a little bit towards the end of our conversation today about how to get that help if you or a loved one is concerned. And so the first thing I would recommend that you do is talk to your primary care physician, your PCP, your general practitioner. So this is the healthcare provider who has kind of been with you, hopefully for a while. And they have a good sense of all the different doctors who you see, a good sense of your whole medical history. And they're kind of the point person. So I would recommend talking with your primary care doctor about any changes that you've noticed, any concerns that you have about your mood, but also about your thinking, as well as your physical functioning. And if your doctor shares that concern, if you're concerned, hopefully they'll be concerned as well. And they might refer you to get some more workup. And so you might come to see us as neuropsychologists. And so I wanted to give a little bit of a sense of what that workup looks like when people are concerned about their memory or their thinking. They've noticed some changes. They're going to get 3 different pieces of information to come to a diagnosis of what's going on. And those 3 big pieces are a neuropsychological evaluation, which I'll talk more about. That's kind of our bread and butter, what we do every day. But there's 2 other pieces to that. So we are PhDs and PsyDs, not medical doctors. We work very closely with neurologists, the medical doctors, and we want you to see them as well. So the neurologists kind of put together the physical aspects, the structural parts of how your brain is working, and they'll use these neurodiagnostics, which is a very fancy phrase for saying an MRI, a picture of the brain. They might get that done. You'll get a picture of the brain, see how that structure is looking from the neurologist perspective. And then for us as neuropsychologists, we are going to take a look at your thinking, your daily functioning, and your mood. And so I love this. Dr. Romano Morris put this picture up. You get a neuropsych eval and you get a neuropsych eval. And so, we're like Oprah today talking about neuropsychology. And so this might be a step that you or a loved one, wants to take to get a better understanding of what's going on with your thinking. And so what this looks like, briefly, is we take a look at different aspects of your thinking. We look at those brain behavior relationships to understand how well are you paying attention, processing the information you see, learning and remembering information that you see and hear. And how does that relate to the thinking of other people your age? So, we wouldn't compare you to 20-year-olds or even 50-year-olds. If you're 72, we would compare you to other 72-year-olds. And we also want to take a look at how you're doing day to day. So those activities of daily living that Dr. Romano Morris talked about earlier are really important for us understanding how you're able to use your thinking skills to care for yourself day to day. So we want to ask about things like, are you having any troubles with driving or with managing your finances or your medications? And we know that people take a lot of important medicines to protect against some of those risk factors that we talked about, like high blood pressure and diabetes. So we want to make sure that you're taking those as prescribed. We also take a look at how you're doing with your mood. Have you noticed feeling down, feeling sad, feeling nervous or worried, getting more frustrated or irritable than you used to? Because that might be potentially a reaction to some changes in your thinking, more trouble doing things than you used to have. But it can also kind of create an issue where if you can't come up with the word and then you start feeling really nervous, and what if I have dementia? That's going to make it all that much harder to come up with the word that you wanted to come up with. So we want to take a look at all of these different things to understand what's the diagnosis. Is this typical for aging, for being 72 or 65 or not? And if not, what might be the cause of these changes that you're having in your thinking? And we don't just care, what is this, but more importantly, what do we do about it? So we give our patients who come see us a long list of recommendations, and we talk with them about what they can do to help, whether that's treating a condition, and also maximizing safety day to day, improving their quality of life, building their support networks. So there's a lot of different pieces that we take a look at and that we have conversations with our patients. So we've talked about a lot here. Yeah, go ahead.
I was just going to say, so being mindful of time, because we've got just about
Yes,
one more minute. I
Right.
think we've talked a lot, this last section is about, things that we can do to help protect our brains. And I think we've talked a lot about this, throughout our presentation. And really, as I said, as we talked about before, it really boils down to staying socially active, cognitively active, and physically active. They're the three most important things that you can do for your brain at any age, and especially have good research in terms of slowing cognitive decline as we age. And then I think the other piece here is certainly healthy diet. There's a lot of research on things like the Mediterranean diet that have good research in terms of, reducing the amount of red meat that you have, eating lots of good, plant-based materials that are excellent for you.
That's right.
Good for your brain to get lots of different nutrition.
Right, exactly. And the main point of that is a diet that's good for your heart is going to be good for your brain. And the last couple of things I just wanted to bring up is just about sleep, that, and we can, this will be posted. And so you can take a look at these different sleep recommendations, but certainly if you're snoring or thrashing around in the night, worthwhile to talk with your doctor about it. To again, rule out some of these other things that might be causing cognitive changes, some strategies to use to help make things easier for you day to day. And so we'll just leave those up for you to take a look at as well. And just one final word that I think it's important to be mindful if there's anything that suggests, that it will cure memory problems or that it's a scientific breakthrough, just to be wary and always talk with your doctor about any new supplements or pills or brain training things that you want to try out. Check in with your doctor to make sure that it's based in science. And so we really appreciate you all talking with us today. And I want to open it up to any questions or comments that people have. I know we're a little bit over time. I want to be respectful of people's times. But here are some take-home points, and you can feel free to let us know if you do have any questions that we can answer today.
Well, thank you both so much. I mean, there is just a ton of information there. I had worked with Dr. Fuchs and Dr. Manning over the years, and I can see how this presentation has grown and morphed and become your own. And I learned some new things today as well. So fantastic. We had a couple of little two quick questions in the chat, and then we'll go ahead and encourage others to ask questions. I know, understand that people have to jump off, but if everyone can stay on to hear, to get their questions answered for a few minutes, and that's okay with you both, we can certainly do that.
Absolutely. I've got plenty of time. So
yes.
That's awesome. So somebody was I think maybe she just sent it to me, but she was asking the difference between educational and cognitive enrichment. Is there a difference between that? And then will people be able to get the slides that you showed today as well. I mean, I know I said we're recording this and we're going to put that on our website, but may we share the slides as well?
Sure, that would be perfectly fine. We're happy. I can prepare the slides for you and send a PDF to you so you can share those out.
That'd be great. And I can just, yeah, you can send them to me and I'll go ahead and share them to folks that are on today.
Sure, that sounds great. And to the question about education and then cognitive enrichment, they're really kind of one and the same. I just broke that up in terms of thinking about formal education early in life, that's when people are getting a lot of that cognitive enrichment, but that it's important to continue that on even after formal education or schooling. So yeah, they're kind of one and the same. Anything that helps to challenge your brain, anything that's novel is going to be good for that cognitive stimulation and your brain health.
And I think another, I always try to remember to tell people this, that I believe this is still the case, that folks can get, once they turn 65 and get on Medicare, they can get that cognitive screening as part of their wellness checkup for Medicare. Is that still the case?
Yeah, that's correct. So a lot of times, primary care physicians, as part of that Medicare visit, will complete a mini cognitive test with you. And so, again, that's kind of a quick snapshot of where is your thinking at generally. And oftentimes, primary care physicians will use that as a guide as to whether or not they recommend, follow up with a neurologist. But ultimately, I always tell people, if you're concerned, we're concerned. This is why we exist as a profession, is so that we can, it's a good day for me to be able to just say, hey, this is consistent with normal age and you're doing great. That makes my day. So, it's not a bother for you to come in and do the process. We'd rather you do that and have that information than not.
And frankly, I almost think that everybody should get kind of a cognitive baseline when they turn, 65 or whatever it may be. There's no magic number, so that, things might look just completely fine where we would expect it to be. But then we have a snapshot against which to compare it to later if people start to develop some difficulties. And then we can compare people not just to other people their age, but actually to themselves a few years ago.
Getting that baseline. Yeah.
Exactly.
And
Yeah.
then somebody's has asked, what the thing that gets covered by Medicare, the cognitive test that gets covered, it's not just the mini mental. Is that correct? Is it more than just the mini mental exam?
So certainly, to have a full neuropsych evaluation, to come and see us, that you need medical necessity, and as long as that if you're an older adult, that's enough medical necessity to say, because it's a risk factor for dementia to substantiate getting an evaluation. What I will say is that there are a lot of different neuropsychologists out there, and a lot of times private practices might not accept Medicare, and so going to the larger hospitals is where like UVA, we have a lot of Medicare patients that we see, and then Medicare usually covers the cost of the full neuropsychological evaluation.
Okay, so even if they got something that was just very brief as part of what Medicare covers, Medicare would cover a more extensive exam
Correct.
with a neurologist as well.
Yes.
Okay, and then if you wouldn't mind putting in the chat your contact information for both of you, we're getting some requests for that as well.
Sure.
And are there other questions? Feel free to unmute yourself and ask a question, or go ahead and put it in the chat if you would like to, and I can read it out. Oh, is there a good formula for the type of exercise and how much? Like, how much should you get your heart rate up for how long? And, what about weight for strength training? How much weight? Like that? Is there a place to go to find that kind of information, or do you have recommendations for a formula for that?
So certainly, as Dr. Riley said, we're psychologists by training, so a little bit out of our purview in terms of making specific recommendations about physical activity. So I often tell, people that, whatever your primary care physician says or your cardiologist says, if it's good for your heart, it's good for your brain. Certainly, I've heard, a cardiologist say 20 minutes of elevated heart rate a day is kind of what you should be aiming at. But, everybody's a little bit different, and, work together with your physician to figure out what's an exercise regimen that's safe and effective for you.
And if there
I heard somebody say once, the best exercise is the one that you do.
That's right. That's right.
That's exactly right. Yeah, having it be sustainable, something that you will do over time, is much more important. Yes, we are at UVA in Charlottesville. We're here at UVA Health in the neurology department for the question that just came through on the chat.
Yeah. And okay, right. Thank you. Yes. And let's see what else. Obviously, people are very grateful for the information. Matt, clinic care for my mom, highly recommend.
Yeah, I will put in a plug. Our clinic is really unique. Dr. Manning, who's the director of our clinic, developed the memory aging care clinic to help not only provide, folks with diagnosis, but we provide ongoing care after the diagnosis has been made. And so it's a little bit of a unique clinic because we work with all kinds of different professionals. Neuropsychology is on the team, and we see patients after they've been diagnosed and provide support and interventions for whatever problem the family or the patient themselves might be presenting with. And so it's a really unique clinic, and I've really enjoyed having that experience.
That's for sure. We're very lucky to have that resource here for sure. Other question, I want to just give everybody one last chance. If you have a burning question that you haven't had a chance to ask yet, go ahead and put it in the chat or unmute your microphone and go ahead and ask. I want to let folks know that this is part of an ongoing series that's presented by the Piedmont Dementia Education Committee. And we will have another series, another session in July, and then culminating in an annual dementia education conference on October 20th, which will be in person, we're happy to say, this year. So you can find out more information about that on our website at agingtogether.org. Well, I don't see any other questions, but I want to thank you both so much. It was really a lot of great information. You really covered a lot. I think it was very helpful for sure, based on the feedback. And like I said, I certainly learned something new as well. Please give my best to all your colleagues over there. I missed them. I haven't seen them for a long time, but thank you again so much.
Thank you so much, Ellen. It was a pleasure to have this platform to be able to be part of this series and talk about aging and cognition. I really appreciate it. And thanks to everybody for taking the time to talk with us today.
Thank you. Have a great day, everybody. Have a great rest of your day, and we'll see you
Thank
soon.
you, you too.
Thank you
Bye.
so much.
Thank you.
Thank you all. It was great.
Well done.